It's great to welcome to the program today Anna Muldoon, who is a former science policy advisor at the Department of Health and Human Services, currently a PhD student at Arizona State University studying infectious disease and social crisis. So great to talk to you today.
Hi, David. Good to talk to you.
So I recently read an article by a Turkish author. I actually forget their name, but it talked about some of the social similarities that have taken place as infectious disease has spread in different times in sort of moderately recent human history. That denial is often an initial reaction from places outside the initial sort of perceived source, that scapegoating is very common, finding some initial group or country or whatever. Right now, there's a lot of talk of China. Jews were blamed for the plague in times past, et cetera, et cetera. And also the idea of the disease as a personal failing, a human failing of some kind, which can take some different forms. Maybe we can start there. Like, what are the general trends that you have studied and seen over time related to infectious disease?
So you nailed a lot of them there, actually. Um, Disease as a personal failing is a really old conception, and disease as punishment is a really old concept. We've had that embedded in particularly Western Christian culture for a very, very long time, going all the way back to the Bible, plagues and Pharaoh, but also all through European history as infectious disease appeared and disappeared. There were moments where it was viewed as punishment from God for social sins, punishment of the individual for individual sins. And as we moved into a sort of more secular moment that has transformed really in the 19th and 20th centuries into sort of individual punishment for some behavioral failing, whatever that might be. So sometimes it is, drinking or partying too much, cholera. 19th century cholera was blamed on European immigrants who were sort of a bit more lively than their counterparts in New York City, and then were blamed for having cholera, saying it was spread either by beer or occasionally by communion wine. That one was interesting. And then sort of as infectious disease has spread this time, we've seen a lot of people talking about New Orleans and, Mardi Gras being the spot that spread it through New Orleans because those people needed to party, which is not really totally fair to New Orleans. And it's still very present, I think, in the ways that we talk about COVID and the ways that we have talked about disease spread now and really for the past several thousand years, unfortunately.
The idea not just of the disease as punishment for sin, but of prayer maybe as a protector. How far back does that go? I mean, we recently saw this video of a woman leaving a megachurch where she said she's covered in the blood of Jesus, so she's fine, and so on and so forth. That I'm guessing that's also not new.
Nope, also not new. Very much not new. It's what's interesting is that the ways that that worked kind of pre-Reformation are a little bit different. And it was more kind of prayer covering the whole community, but also a sort of acceptance that disease was part of life.
Mm.
Now, and in particular in the United States, there have been fights about national prayer to combat epidemics all the way back to the 18th century, right? In 1721, there was a large smallpox outbreak in Boston, and there are fights about prayer and predestination as they begin to introduce inoculation, and whether you should simply pray that you survive because if you're a good person, you'll survive, or whether you should take this inoculation, which at that moment was viewed as possibly, violating predestination by messing with the plan. And then in the 1830s and 1850s, with cholera on the east coast of the United States, there are some impressively intense fights about national prayer to prevent the epidemic. That in some cases actually threaten to unseat a variety of politicians and turn into political issues as well as religious issues. So that one's old and very embedded in American culture.
So for me, this is a part of, at least right now, seeing the current administration's handling of the virus, at least over the last month, really as a culture war rather than a medical war. And I did a segment about this earlier this week. My perspective is that they've essentially failed on the medical war, so they're making it about culture and values, which are much more pliable in terms of empirically determining what it is that's going on. And so masks have become a signal of your perspective of as to what's going on. Open versus close has become an issue of government tyranny and so on and so forth. Is this the way this often goes, where it becomes a culture war?
Um, Honestly, having studied a lot of disease history, I would say that this kind of polarization of responding to disease is fairly unusual.
Mm.
The fights around infectious disease do often fall on cultural lines, right? So there's an author I love called Desserteau who talks about the ways that in certain moments, the things that underlie society, the tensions that are already there, kind of break apart and come to light. He talks about these tensions that exist that we all live inside, sort of rising up from under the streets. It's a beautiful passage. But I think the commonality among infectious disease outbreaks is that they intensify and make very visible social divisions, social tensions, and existing problems. But rarely do you see this kind of pretending that a disease just doesn't exist in communities where it does. I obviously am studying this as I'm working on it because it's both fascinating and a little disturbing.
To what do you attribute it? I mean, why it seems too simplistic to say, well, it's because of Trump. I mean, he seems to be the one who is at the top of the federal government right now, but there's some element of society allowing that to take place as well, right?
Absolutely. I think that America for a long time has been deeply divided along urban and rural lines. And that has very much played out in COVID, where the early outbreaks were very much in urban areas where people travel more. And it's only now that they're really moving into rural areas. So for a long time, the pattern of COVID in the country actually exemplified that division. I think that America has for a long time had some intense class division among types of workers. And that is also very much playing out here, where a lot of workers simply can't stay home. And so for those who can, responding to the disease is a different type of ask, right? Asking me to work from home on historical stuff or policy is a very different ask than asking that of someone who works in a factory where working from home isn't an option. So some of it, I think, is also about the ways people have to justify their own need to, eat and continue working and feed their families. And then some of it is the intense polarization that we've experienced over really the past 10 years. I think that divisions in what news we watch, what radio shows we listen to, what newspapers we read have really made it possible for there to be multiple worlds based on the same information in a way that just hasn't historically always been true.
When it comes to talking now about stigma of disease itself, there's certain diseases that have more social stigma attached to them. So certainly sexually transmitted infections and diseases would be one category. Within cancer, lung cancer sometimes generates less sympathy because it can be connected to the bad act of smoking cigarettes, as an example. Where do these types of pandemics that, like coronavirus, kind of fit into the stigma analysis?
So I wish dearly that I could tell you that pandemic disease was an exemption from stigma. Unfortunately, I don't get to say that. So it's lower on the scale than things like STDs or lung cancer. Um, Higher on the scale than zero.
Right.
So we are starting to see problems where people have recovered from COVID and are having difficulty still getting ambulances to come to their house, or their neighbors don't want them to leave the house or want them to move out of the neighborhoods. Businesses where the owner has recovered, where no one will go inside because they're afraid of the virus. And I think that that is something we will probably see expanding. There has also, unfortunately, been a lot of racialization of this virus that has caused serious problems in a lot of Chinese American communities, but also, unfortunately, other Asian American communities. That isn't so much disease stigma as disease blame and kind of racialization of the disease. So I think that those are things that we as a society and as a nation need to consciously combat and pay attention to. Because no, someone that recovered from COVID 4 months ago is not going to give you the virus, but people are still afraid.
It
And
seems
that
one of
is a
the
problem.
ways where the stigma is entering a little more is with some of the reports that, for example, of the younger people that are dying, overwhelmingly they are obese, and obesity is often associated with moral failings rather
Yeah.
than medical conditions. So it seems maybe that's one way in which it's creeping in lately.
Oh yeah. I actually started the first year and a half I was in public health. I was doing research on obesity stigma. Um, I found infectious disease to be a less depressing topic, if that
Right.
tells you anything about how bad it is. Yeah, I think that absolutely a lot of the things about pre-existing conditions are allowing people to blame those who've died of COVID for their own deaths, which is deeply frustrating. Uh, you know, most of the pre-existing conditions that really predispose people to dying from COVID are those that are really frequently linked to structural factors in economics, in race, in access to medical care, in location. And so it is kind of quadruply frustrating to then watch them become a way to write off COVID deaths because they're almost entirely structurally linked comorbidities, I guess is the best way to put it.
Yeah, no question about that. And that's often missing from, the science. Science can tell us a lot of the facts, but it rarely tells us about the economic and sociological factors that kind of led to those being the facts. We've been speaking with Anna Muldoon, who's a former science policy advisor at the Department of Health and Human Services. Anna, so great to speak to you. I really appreciate your time.
Of course.